Stroke can happen to anyone, including children. About 800,000 people experience a stroke every year in the United States of America, while around 400 children have a stroke annually in the United Kingdom. It is estimated that about 2 million brain cells die during every minute of a stroke. What is stroke? A stroke is sometimes referred to as a brain attack. It is a critical, fatal medical condition that happens when blood flow to the brain is interrupted, insufficient, or stops completely, thereby preventing the brain tissue from getting oxygen and nutrients. It is a medical emergency. Every second matters in treating a stroke, as the brain cells in the affected area begin to die within minutes. Getting medical help to a stroke patient on time usually makes a big difference. The sooner a person gets help, the better the chance of mitigating the damage. It is even claimed that an emergency help within an hour can prevent long-term disability or death. A stroke can affect the entire body. Stroke signs often occur suddenly, with the signs usually varying from person to person. While a stroke can happen gradually, one is more likely to have one or more sudden symptoms of an impending stroke, such as paralysis, numbness or weakness of the face, leg, or arm, which is usually on one side, difficulty speaking and or understanding, eye problems, especially loss of vision or dimness in one or both eyes, dizziness or difficulties with balance or coordination, complications with walking or movement, fainting or seizure, and severe headache that suddenly occurs. Less common symptoms include unexpected nausea or vomiting, not caused by any known reason, sudden but brief loss of consciousness, confusion, coma, and vertigo. F.A.S.T. The National Stroke Association have an acronym called F.A.S.T, which is formed from face, arms, speech, and time. This helps to ascertain if there is an impending stroke. Let's break F.A.S.T, FAST, down further. F, that is, face. If you ask the person having the symptoms to smile, one side of the person's face will droop and smiling may be difficult. Arms. If asked to raise both arms, one of the arms will drift downward or difficult to raise. S, speech. If asked to repeat a phrase, the person's speech will be slurred, garbled, or hard to understand. The person may not be able to speak at all. T stands for time, which means if any of the above symptoms to the face, arms, and speech applies to the person, you need to call the ambulance ASAP, as time lost may translate to brain lost. Therefore, act fast. Causes of stroke. All organs, including the brain, need oxygen and nutrients provided through our blood to function properly. If blood supply is constrained or stopped totally, the brain cells begin to die. This can lead to brain injury, disability, and possibly death. The two main causes of stroke are ischemic, where the blood supply is stopped due to a blood clot. This sort of cause accounts for about 85% of all cases, and hemorrhagic, that is, when a blood vessel to the brain bursts. Ischemic stroke is the most common type of stroke. Blocked or narrowed blood vessels can be caused by fatty deposits build up in the blood vessel, blood clots, or other remains that travel through your bloodstream. Factors that may cause hemorrhagic stroke include uncontrolled high blood pressure, overuse of blood thinners, also called anticoagulants, bulges due to weak spots in the blood vessel walls called aneurysms, and trauma, that is, a shock. Related to these two causes, that is, ischemic and hemorrhagic, is transient ischemic attack, TIA, where the blood supply to the brain is interrupted for a temporary period. Transient ischemic attack, also called a mini stroke, can have similar symptoms as a full stroke. If your symptoms go away after a few minutes, you may have had a transient ischemic attack, TIA. This sort of attack does not normally cause permanent damage. While TIA symptoms are short-lived, which can last from a few minutes to 24 hours, you will need to take this seriously, as having a TIA increases your risk of having a full-blown stroke later in life. But many people ignore this and assume they were lucky and have escaped a stroke. The treatment of a stroke depends on the type of stroke, which part of the brain is affected, and the cause of the stroke in question. Many people with stroke experience some memory loss. Others may have difficulty thinking, reasoning, making judgments, and understanding things. Emotional problems and depression may also set in. Pain, numbness, or other unusual sensations may occur in the parts affected by stroke. People who have had a stroke may become more withdrawn and need help with essential routines. It is estimated that about 2 million brain cells die during every minute of a stroke, as said earlier. In a 2018 publication of recommendations from the American Heart Association, AHA, and American Stroke Association, ASA, it is stated that treating a stroke victim within 4.5 hours with a blood clot dissolving drug gives the victim a better chance of avoiding major disability, which could have led to irreversible brain damage or even death. Strokes can usually be treated with medicines that prevent and dissolve blood clots such as aspirin, reduce cholesterol levels, and control blood pressure. If the stroke was caused by a burst blood vessel, how to stop the bleeding will likely be the medical practitioner's priority. A stroke that occurs in the back part of the brain is called posterior circulation stroke, while the one that occurs in the front part of the brain is called anterior circulation stroke. They both can occur due to blood vessel blockage to the individual parts of the brain, causing the death of brain cells referred to as an infarction. The symptoms for each area can be different. Surgery may be required to remove blood clots, treat brain swelling, and reduce the risk of further bleeding if this was the cause of the stroke. Survivors of stroke are often left with long-term problems caused by injury to the brain. While some people require a longer period of rehabilitation to recover, many never fully recover, thereby needing ongoing support afterwards. Risk factors. Some conditions have been confirmed to increase the risk of developing a stroke. Lifestyle risk factors. Lifestyle risk factors include being overweight or obese, physical inactivity, heavy or binge drinking, and the use of illegal drugs such as cocaine. Medical risk factors include high blood pressure, cigarette smoking, including passive smoking, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease, including heart failure, heart defects, or abnormal heart rhythm, personal or family history of stroke, heart attack, or transient ischemic attack. So, initial research suggests that COVID-19 infection may be a possible cause of ischemic stroke, but study is ongoing. The following categories may also put you in the higher risk bracket of stroke: age, race, sex, and hormone. You are classified as being in the higher risk of stroke if you are 55 years of age or older, of African American race, you are a man, as women are usually older before having a stroke, but women are more likely to die of strokes than men. The use of hormone therapies, such as for birth control that include estrogen, increases the risk as well. Black women in their 50s may have more than triple the risk of stroke compared to white women of the same age, according to a new study. It has been acknowledged that your chance of having a stroke can be drastically reduced if you eat a healthy diet, take regular exercise, follow the recommended guidelines of alcohol intake, and not smoking. It is also very helpful and vital to take your medicine regularly if you have been prescribed these to control your high blood pressure, diabetes, and or your cholesterol level. Take these measures religiously if you have had a stroke or TIA in the past, as your risk of having another stroke is greatly increased, as earlier mentioned. To prevent irreparable damage, you need to know the signs of an impending stroke and let your family and friends know these too. It is advisable that you wear a bracelet or necklace that informs others if you have a medical condition, so that a person willing to help may identify your ailments, allergies, and any medication you may need. Scientific advancement and public awareness have reduced the chance of dying from a stroke. Effective treatments can also help prevent disability from stroke. Seek immediate medical attention if you notice any signs of a stroke, even if they seem to come and go or they disappear completely. Think and act fast. Modification of lifestyle is key, as well as seeking medical intervention to treat those things that put you in a higher risk factor. I do hope this has been as entertaining and informative as you expected. Please let us know if you are particularly interested in any specific topic, and we will do our best to produce it, breaking it down into basics as usual. Kindly subscribe to our channel, LATV Productions, like and share our productions as well. This gives us the impetus to do more. In the meantime, please keeping safe and legit. Prince Lanre Adego, aka Kabiesi.